This is the Veterinary Project Podcast, episode 137.
Welcome to the show created by vets featuring absolutely no pets. This is the Veterinary Project Podcast, hosted by Dr. Michael Bugg and Dr. Jonathan Light. Our resident veterinarians have swapped out their stethoscopes in favor of microphones to bring you the Veterinary Project Podcast, a show focused on real conversations aimed to connect this amazing profession full of remarkable people. Through the sharing of collective stories and wisdom and connecting over the many unique challenges we face, we invite you to join our community of veterinary professionals leading intentional lives. And now, here are the hosts of the Veterinary Project Podcast, Dr. Michael Bugg and Dr. Jonathan Light.
All right, Emily, thank you so much for joining us. I'm very excited.
Thank you for having me.
I mean, we've been...
Thank you so much.
We connected first on an author's book panel, I believe it was. And yes. I mean, that was at the start of the year, and it reached out and was like, let me know as this book is landing. We'd love to have you on. So congratulations. I think as we're recording this, your book officially launches the next day. So by the time this airs,
yes,
this book is out in the world. So congrats.
Yes, my baby's out there, or will be out there by the time everyone hears this. So very, very excited.
You should be, yeah. So, I mean, we're going to dive right into the book. I was going through it, and I have to say, I was like, wow, there is so much here. In some ways, I was like, this is like a textbook. Like, this is like the go-to resource if you need to know anything about pregnancy and postpartum in the veterinary world. Like, I can't believe how many different topics there was that I hadn't even thought of.
Yeah, when I was, it was published by an academic press who normally does publish textbooks. And so when I was kind of going through and working on it and sending kind of sample chapters out for review, you know, there was some feedback to maybe kind of make it more of this rigorous, you know, academic work that could then be studied in a course and taught and that kind of thing. But I kind of tried to strike a balance between it being a reference, but also being just very approachable. Kind of the way I described it when I first started talking about it is I wanted you to be able to kind of sort of almost roll it up and stick it in your lab coat pocket if you wanted to, and just kind of pull it out. And, you know, if you only want to read about radiation, just be like, okay, I'm going to read this chapter and this feels like digestible and it's not overwhelming and it's not so like pretentious that, you know, I can't get through it without wondering what it, you know, what everything means. And then I also wanted it to just be very relatable because it's a stressful enough sort of season of life and topic to approach anyway. That I wanted to make sure that it felt comfortable while still giving everyone the information. So that was kind of the vision I had for it.
Nice. Going through it, I would say I felt quite comfortable. Like, I really liked the chapters all open with stories. So immediately you can relate, you know, you can see that story unfolding. And then you end each chapter with just the take home points where, you know, if you want to jump to like, okay, here's all the stuff you really need to know. And then in the middle,
right,
I was after, especially since I had written a book, the amount of research you have done is mind blowing to me. Like, I was just like, the number of references and tables and charts, I was like, it is very well researched. So there's a good balance there, I would say.
Well, you kind of get into it. And it was one of those things when I started it, I didn't know it was going to be as, you know, as much as it is now. You just get into it and you're like, okay, well, whatever I had planned, that's not enough, because now I see this needs to be explained. This needs to be researched. We need to find out, like, what am I really going to tell people about radiation, about anesthesia, about talking to your boss? You think maybe I at one point thought maybe it would be a website, maybe it would be a pamphlet. And then as I started researching it, that was where it just turned into a book, because that's just what it had to be to include everything that I felt like needed to go in there.
Yeah, absolutely. So I guess it begs the question as we kind of kick off the discussion, why write this book?
Yeah.
Right? Like what drew you or compelled you to put in the work, because it's a lot of work to bring this to life?
Yeah, it was just this nagging feeling that I had over the years. So, and I've shared this story a few times previously, but I think it's just important to share. So I found out I was pregnant with my first child about 3 months after I graduated from vet school. So I was working my first job and always wanted to be a mom and have kids. But, when it happened, I found myself just completely unprepared, as many first-time parents do. And, didn't know what I should be doing, what was okay to do while I was working around all these potential workplace hazards. Would I be fired for getting pregnant and needing to go on maternity leave before I, maybe just barely worked a year in practice? What would that even look like? How am I going to go back to work when I have a baby? All this stuff. And I just found that there was no one who could really answer those questions for me. And there wasn't even really a place I could go to find that. And so early on in my career, I was very worried about not letting my pregnancy and my having a child, inconvenience anybody else. I wanted to be that eager young professional who never let anybody down, who was just kind of always there. And I didn't really think a lot about what I needed and what I deserved, and whether I was, really getting the support and the resources that I needed. But then as time went on, I really felt like I wished I could have more support. I wish I could have those resources. I wish I could find the answers to my questions, because I was going around asking all kinds of people questions. How safe are dental, radiographs? How safe is it to be standing right next to the beam? How safe is it to be in the OR every day doing spay neuter when you're pregnant, and potentially having some isoflurane exposure? And I just got these answers that made it clear that nobody really knew, or no one, even if they gave me an answer, they couldn't back it up with any actual concrete information. So eventually, after kind of having 4 kids while working in clinical practice, I just decided this is not out here, so I'm just going to create it. And like I said, even when I first had that idea, I didn't know that it was going to be the book that it is. But once I started doing it, I just thought I have to do it right. I have to make it something I'll really be proud of. And then this is what it grew into.
Good for you. And you could see that as a common theme. You do introduce and you have guests share some of their stories. And I noticed that jumping out a lot, where some event would happen and they would approach their medical care provider, and the answer would be some version of, well, I don't know, like you tell me what antibiotic we should use.
Yeah.
Like, I have no idea. And I was like,
yeah, that was me. My OB was like, which antibiotic do you want?
Yeah. So I have to ask,
like, aren't you my doctor?
Yeah. What shocked you the most, or maybe jumped out the most? You have an expectation, and then you start actually doing the research and getting some facts. Was there anything that jumped out that was like, wow, like I didn't expect that, or that was shocking?
Well, in terms of kind of the first half of the book, which is all really like workplace hazards, I was surprised that with proper precautions, radiation exposure is actually a lower risk activity than I had thought before I started doing the research. And I'm not saying, all pregnant people just go out there and, shoot tons of x-rays, but I think just from my research with all of the advances in technology with radiographic, equipment, and what we know about how to stay safe that risk can be very low if you do end up having some exposure. Same with anesthesia. There are definitely ways to work safely around anesthesia during pregnancy. So those things were reassuring and surprising to me. I think one of the other big things that I sort of knew, but it was still very depressing to have confirmed in all the research, is just how poorly the United States does parental leave, and how that impacts men, women, mothers, fathers, just all parents, when they're trying to grow their families and
Yep.
still continue working. It has so many effects, both, physical and mental, that we don't seem to be able to figure out a solution for. And I know not, other countries that do a better job, I'm sure they could still come up with a list of things that they would like to be better or different, but it's still disappointing.
Yeah, I know before we hit record here, the three of us were kind of kicking that around a bit, and it is shocking.
Yeah.
I'm up in Canada for our listeners that maybe don't know, and me and my wife, we had our 1-year-old, so we're about a year removed from our last child. And then I remember chatting with people, and okay, I was it at the 6-week mark, or like the mat leave in the United States is very short, and it was like, this is
it can be
physically taxing, on Rosalie, that's my wife, like giving birth and nursing and all that, and now you're going to go back and do, or be expected to do, such a demanding job. I was like, wow, like it seems off, but I don't know what the fix is.
And there are so many. Go ahead.
I'll jump into that for a second, having worked in both the States and Canada. If there's an area where I was, unfortunately for yourself, Emily, where I was proud of Canada, is just looking at what the forward-looking needs are for women coming out of, any type of pregnancy, and the ability, time to both recuperate physically, and then the mental needs that are associated with those, with children that are just coming into the world. How do you do that in a 6-week time frame? I remember working with some clinics down in Seattle area where you had maternity wards or rooms that were set up for moms to be able to work and nurse at the same time, only 9 weeks after. And I went, how is this even possible? And it's definitely not that the Canadian system is foolproof or amazing, but there's inroads that can still definitely be made, and that's related to both, I think, the woman and the man that's involved. Yeah, if a woman and a man are involved in this, because there's so many different permutations that can now take place.
Yeah, definitely. And I really feel strongly that in order for parental leave to be better for, birthing mothers, it has to be better for everybody else too. Because there ends up being a lot more stigma around birthing mothers taking their leave when they're entitled to it. If fathers and other non-birthing parents don't have any, because then that really singles the birthing mothers out as the ones who are going to need more time off work, as the ones who are expected to just have all of the load at home while the other parent goes back to work. And it just creates this inequity very, very early in the life of the child, and in that newly, the life of that new family, that can have long lasting implications for, the gender wage gap, the motherhood penalty, which involves, wage gap, but also all the unpaid leave, the expectation that the mother is always the one who's going to be with the child when the child is sick, all these sort of unequal expectations about how different parents in the household are expected to care for the child, and what the expectation is in terms of their responsibilities at work. So kind of starting from the get-go with leveling that playing field for everyone, I think is so important. And I think most dads would probably like to feel like it's okay for them to take more leave and to bond with their families, if that were socially acceptable and their employer allowed it. I would imagine that would be the case. I don't know what you two think.
I'm pretty fortunate. Rosalie and I are both self-employed. So, I mean, one of the cons is we didn't have paid parental leave of any sort for either of us.
Right.
That was also our own choosing. We could have opted in, years ago and started paying into it and then collecting. But anyway, so where I'm fortunate is I got to spend a lot of time with my infant children. And it is awesome, and I look back and that time we'll never get to have it again, right? Like they only grow up once, and it's been a blessing, And I know with Riley was right during COVID, and so the world kind of shut down, and I was like, this is awesome. Like we spent so much time with our newborn.
You guys are all home together.
Yeah.
Yep. And it's interesting because I'm the third party in here. And I went back to work, I think, after our second was born, after about 5 days off, which I thought was pretty good. I'm that, again, more in the past traditional where it was back to work. It was, hey, there's some things that need to be looked after, and, able to spend more time where I could. So I don't feel regret to having to go back to work at that point. Different circumstances, different times. So it's kind of nice to see the three of us in three different scenarios here. Yeah. And I think that was the first for our first as well, too. Even though I did have parental leave and could have taken it at that point in Canada, chose not to.
Yeah. I will just say, as the one who gave birth in my family, that because my husband, I had kids in 2 different marriages. But, with my first 2 kids, I think it was like 2 or 3 days off that he got. And with my second 2, maybe he got a week off, my husband, when I had the baby. And then the no paternity leave. But he was able to save up vacation so that right when I went back to work, I worked 3 days a week. And so he would take those 3 days off. Oh. So to be with the baby just for like a couple weeks, that was all the leave that he had left, just to kind of have his bonding time at home with each of our sons, and also kind of push back the daycare start date just a little bit. But I got to tell you, I would have really appreciated if he could have had more time home when I was home, because I really needed that support. I really needed that. I was still healing physically. I was not getting any sleep. I was breastfeeding and pumping and washing bottles and all that stuff around the clock. I was, dealing with a baby that was sometimes colicky. I was dealing with my own postpartum mental health struggles. And, there was no one else in the house really to help me because we didn't have family close by. So I think that's the other thing we need to think about is, that non-birthing parent, the partner, may not always feel like they necessarily need it for themselves, and maybe they feel guilty or uncomfortable about taking that much time away from work. But it can be such a game changer in a lot of cases for that other parent, whether they've given birth or not. It's still just such a complete and utter change in their life, and just total disruption of their schedule, of the way they do everything. And it can be very jarring some of the time. So I think that's another reason to really think more about the ability and the opportunity for the other parent to kind of be there for more of that. So no, it's not always possible, but it's still my dream and my vision that will continue to change.
Yeah. No, that's a great point. I want to kind of go a little deeper there. As the non-birthing parent, this is just my perspective of it, is like, we're also scared and anxious and have no clue what we're doing, especially on the first one.
Yeah.
What advice would you give, to the non-birthing partners listening? Because I know when we say support, and I totally agree, we're there to support in however we can, but sitting there deer in the headlights, what specifically would moves the needle the most?
it'll be, you know, a little bit different for every family, but just kind of taking initiative to say, you know, don't worry, I got this. You know, look around, see what the needs are. I think I don't want to generalize. You know, sometimes there can be a sense of, well, I need you to tell me what you want me to do. You know, just kind of assessing the situation, assessing, okay, you look like you're tired. You look like you've been holding the baby for, you know, the past 4 hours. Like I'm going to take over, or you're good. You've got the baby. You need to keep feeding them, or whatever the case may be. I'm going to go get the dishes done, or I'm going to go order some food. You know, something like that. It doesn't always have to be kind of in a secondary supporting role, but maybe, you know, taking a little more initiative and saying, okay, I would like to have this time. And maybe the other parent might be a little resistant to the idea at first, but hey, let me do this. Let me step up. Let me have this time. Go take a nap. Skip this feeding. There's a bottle. Don't worry, I got this. And just kind of finding ways to, and of course, you know, everyone's going to do things differently. And sometimes it's hard, you know, initially it was hard for me to just be like, oh, well, that's not how I do that. And, you know, I, as a birthing parent, also have to learn to step back and be like, you're totally entitled to do these things as an equal parent. So I need to kind of step back and let you do that however it is you figured that out, and however it is that you want to do it. Because if I want to be supported, I have to let the other person support me. So yeah, I think it'll look different for everyone, but just kind of feeling that sense of confidence to kind of look and see where the need is, and create your own traditions, create your own ways of bonding with your child.
Yeah, I like that piece on like also allowing them to support it, because it can be very difficult. But I
talk about that briefly in the book, you know, about like not micromanaging your partner, which I think is very important. And I think I need to remind myself of that, you know, too. Like, I ask you to do something, I can't tell you exactly how I want you to do it. I just need to like let you do it.
Yeah. I want to shift gears a little bit. There was one theme in the book, I guess one whole chapter that I really wanted to jump into, was announcing pregnancy at work. And what I really liked about that chapter was you have, you know, kind of experimented with that in your own life through multiple pregnancies. And I think you approached it slightly different, you know, with each child. So I'd like you to share your story. And then I understand it's going to be very individual, so everyone's going to come to their own conclusion. I was reflecting on that as a veterinarian in clinic, and there was times that I can think of where, you know, I was working with someone that was pregnant, but I didn't know at that time. So I couldn't make any adjustments, right? But it all seems to boil down to communication. You know, like you said with radiation, I was also shocked at how much it can be mitigated and how, you know, safe it can be with proper precautions and safety equipment. But first there has to be awareness that, okay, this is what we're dealing with here, so that those tools can be put in place. So I'd love to hear kind of your story on announcing it at work.
Yeah. So with my first pregnancy, again, I felt very unsure of what I was doing kind of then, and a big sense of, I don't know if shame is the right word, but just kind of fear that I would be judged or looked down upon, that I was this new grad and here I was pregnant and I was somehow going to be this huge inconvenience to everyone around me. So my first pregnancy, I really didn't want anybody to know. I told, and in fact, I had an accidental unshielded X-ray exposure before anybody knew. And that was what really prompted me to start telling a few people. Because I figured, okay, this is this is not good. Like, people need to know. People need to know that I'm pregnant. People need to, you know, help me stay a little bit safer. And so I told I was working at like a shelter at the time. So I told the manager and some of the technicians, and I think everyone that just kind of gradually found out from there. But it was almost apologetic, don't worry, I'm still gonna come back. I'm not leaving. I'm still gonna do a good job. I'm still, I was almost embarrassed. And that feeling kind of persisted throughout that pregnancy. So I didn't really want anyone to ask me questions. I didn't really want to talk about it. And looking back, I just feel like I made things so much more uncomfortable than they needed to be, because I was very kind of protective and kind of wanted to keep everybody away from that. So I don't really, I would not do it that way again. But then with my next pregnancy, I was in a private practice, and I think I just told my boss individually. I want to say I probably waited until close to the end of my first trimester, because that was just always considered to be, the norm. You wait, you just wait, you don't tell anybody before then. And so I don't remember exactly, but I would probably just kind of, whenever we had a case that needed radiographs or something like that, I would just kind of magically disappear and be like, oh, I have to go to the bathroom or something. You guys take care of it, and kind of hope that no one would notice, because people start putting things together very quickly. You start acting differently. You start going into the bathroom more. You start looking like you don't want to eat. You're the slightest bit sick. Oh, she must be pregnant. And I'm not exaggerating, people do that all the time. And I really didn't want anyone to speculate or gossip about me. And so, and I think I told a few people, and after a while I was like, you tell everybody else, because I don't want to I don't want to tell people. I don't want to say it. It feels weird to me. And then when I was pregnant again, several years had passed, and I still think I waited and kind of told a small group of people and said, oh, but don't tell anybody else. I told my boss and maybe a manager, and it's like, but please don't say, I don't want anybody else to know. And then kind of gradually let other people know. And there was one pregnancy where I told a small group of techs, because I thought, okay, they'll keep me safe. They'll make sure that I don't have anything to do with radiation. They'll help me, with anesthesia and that kind of stuff. And I said, please, I don't want anybody else to know. But they told everybody. And that was very upsetting to me. I don't know why, but it was. When someone told me, I told someone I was pregnant, and he's like, yeah, I already know. That just really hurt my feelings, that people were talking about me. And I said, well, how did you find out? And they said, well, so-and-so was complaining about how your maternity leave was going to affect the tech schedule. And I don't know, I really didn't like that, and people are going to talk, but for some reason I really didn't like that. So during my last pregnancy, it was during COVID, and I thought, I'm not going to do this. I'm not going to do this whole secrecy thing. Just the staff in general at the clinic and the management were not really enforcing the wearing of masks or social distancing or washing of hands or anything. And I just felt very uncomfortable with just the safety aspect related to COVID. So we had our morning meetings. Every morning was everybody who was in the hospital. And I just said it in the morning meeting. Like, I hadn't told anybody. I hadn't told a manager or anybody. I just said it to everybody all at the same time. Because I thought, this way I don't have to hide it from anybody. Nobody will really have anything to say about it. And I just said, I need you to wear your masks when you're around me. And we need to social distance. And I think there was just like silence after that. And that was a really scary thing for me to do, because I did it very early. I'm not even sure I don't think I'd even been to the doctor yet. I hadn't even gotten like a confirmation ultrasound. But I felt so good after I did that, because it was just out there. And I didn't need to feel bad about it. I didn't need to feel secretive or kind of protective about it. And people did start taking that seriously. So that was probably my favorite. It was the scariest way, I think, for me to do it, but sort of ripping that Band-Aid off and not kind of staying in that place of kind of anticipatory anxiety for very long, I think worked out the best. And to your point, Michael, I got the protection and the support that I needed much sooner. And I do make that point in my book and in some of the other social media posts I've made, that we can't expect to have protections, even protections that are guaranteed under the law. We can't expect to have them if the people who are charged with protecting us don't know that we have that need. So I think that is a very important point to make. I mean, ultimately, it's up to the individual to decide when they want to share that. But we can't expect to have, our safety protected. We can't even expect to have our job protected if our management, our employer doesn't know. So if we're, coming in late all the time because we're not feeling well, or because we have a doctor's appointment or something like that, and nobody knows that's the reason why, that could just be interpreted as, poor workplace behavior and judged as such. And certainly you can't expect to have responsibility for certain tasks to be taken away from you if there's no understanding of why that needs to be the case, or even that there is a need. So I feel very strongly that announcing early in the workplace is a good thing. I know it may not be right for everyone, because there is still, unfortunately, a lot of concern about discrimination. And I don't think that that's made up. I think it's real, and I think it does still happen. Most people who engage in it won't admit that that's what they're doing, but it definitely happens.
Yeah, I mean, thank you for sharing those stories. That was the main reason I wanted to ask it. Is there's going to be listeners, that are maybe planning to have kids or whatnot, and getting to hear it from you that has had these experiences is very valuable. So on the flip side of that, you had mentioned, with your third pregnancy, one of the techs complaining about how that may affect their schedule, and then mentioning discrimination here. Let's dive into that. And this is an interesting topic. And to be honest, I don't even know how to frame the questions. I said a hypothetical example before we hit record of let's pretend, the three of us are veterinarians working at a clinic, and we share the on-call schedule. And then all of a sudden now we're out with, one of us is out on parental leave. So now the on-call, and we've chosen we're not doing on-call. Now we're down to two, right? And that shifts things in the clinic. And as you mentioned, you can have people complaining, gossiping, discrimination. Where do we take that? Like, I don't imagine there's anything we can discuss where we've just fixed it for the veterinary profession, but how can we make it better or do better?
And if I may ask, and can I jump in for a second? Just even a little bit further back, what are examples of that? Because in the pre-recording, what are examples of those individual pieces that lead to complaints, harassment, or, as you mentioned earlier, microaggressions? What are some examples that people need to be aware of?
So I can share from my perspective that I personally, I got divorced after I had my first two kids. And so for a while I was a single parent, and I was responsible for picking them both up from school every day. And my shift went until 6 p.m. And my kids they were in elementary school, and they went to kind of an after school program at the school. And they had to be picked up by 6 p.m. No exceptions. And so I asked my boss, I told my boss, I mean, he knew what I was going through. And I said, I don't have anybody else to pick them up right now. Like, I need to be able to pick them up every day that I work. And I think at some points I was able to arrange for a friend to help, like one day a week. And at one point I even paid someone, like a teenager to do it some of the time, but there were still times where I needed to be able to do it. And so it meant I had to leave work early. And I received a comment from another veterinarian who was older than me and had raised his own children that because my boss told me that whenever he was there, he was fine with me just leaving. But if I was working with the other doctors, that I just needed to discuss it with them before I left. And so it created this scenario where every single day I had this anxiety at the end of the day. Like, are they going to be mad at me? And so I went to this doctor that day and I said, you know, are you okay if I leave? And every once in a while he would make these comments like, yeah, I wish I had a reason to leave early. I wish I had a kid to go pick up so I could go home. And it wasn't said behind my back. It was said, you know, to my face. And I can remember there being sort of talk behind the back of one of the receptionists who also had to go pick up her child, about how unfair it was that she never closed and that the other people had to close every day and she always left at 5 and, you know, that kind of thing. I personally have never worked an on-call schedule, but, you know, certainly I can imagine cases where that would be something that an individual who's either pregnant or certainly when they're on the maternity leave, they're not going to be available for that, would not be able to participate in that. And it is also a big problem in both the human medicine world and in veterinary medicine in residencies, where the hours and the schedules are just extremely demanding. And when one member of that resident cohort has to go on maternity leave, it's been documented that there is a lot of resentment among the other members of that cohort who are often just forced to pick up all that extra work for, you know, no additional pay. And so that just creates this huge, you know, stressful scenario for the person who's going on leave and for everybody else. And so when I do talk about this in my book, at least on the human side of things, there's been more discussion about, you know, asking for volunteers to cover that time and then paying them extra, or just bringing in other paid people to cover that leave. And I think, you know, the answer will be different in every scenario, but it's more about just kind of making everybody in the situation feel like their needs and their time and their, you know, whatever their wants are outside of work are important too. You know, we don't want to get into a scenario where we say the only needs that matter here are those of the working parent. You know, everybody else has a life, even if they don't have a baby to go home to. Even if they've chosen not to have kids, they still have the, you know, they still have the right to want to have a good quality of life, to not always be at work, to not have to do extra unpaid work. And I think that's a very reasonable concern for them to raise. So I think, you know, then the question becomes, okay, how can we cover this need in a way that feels comfortable to everybody while still acknowledging that this parent just has to be able to, you know, have whatever accommodations they need, either from, you know, a health and a safety and a healing standpoint, or, you know, because they have to meet their needs, the needs of their children as a parent. So whether that's, you know, paid relief coverage for some of that time, or maybe going back and talking to, you know, all the staff, is, you know, is this something we need to reorganize or readjust with everyone's input? I think if it can be a scenario where everyone feels like they have a voice, there's going to be a lot less inequity, a lot less resentment, hopefully, and it'll be easier to kind of find a solution. I mean, I'm not saying it's going to be perfect, but
no, it makes
I
sense.
think that's an important part of the process.
Jonathan, anything to add? I know you've had various management roles. in your career? So likely you've had these scenarios.
I nod my head and no, but then I think one of the comments that you made early in our discussion is about trying not to inconvenience anyone else.
Yeah.
And how do we get around that? Because that's a real feeling. And how do you move past that, knowing that there is that risk of confidence that if I share, even when after I share, that there are these microaggressions and other even more forceful pieces that come against it, that it's more of a comment versus a question. As you've grown within this book, are there facts that have come to light specifically within veterinary medicine that have made you either more confident in the approach vet med's taking now, less confident, or still neutral to it all?
I think it's a combination of things. So, um, in terms of the piece about, how do I stop feeling like just me living my life is an inconvenience to everybody else? I think a lot of that is just kind of living through the experiences and experiencing more understanding and sort of acceptance and support and help and all those things than I expected. You kind of think, well, everyone's going to be mad at me, everyone's going to hate me for this, and then finding out, no, that's not the case. They actually understand. But I think so some of that's just kind of learning and growing and maturing over time and kind of having those life experiences. I do think there has been a shift, though, just even from when I graduated from vet school in 2005 until now, because I think we have a long way to go, but I think there is, more people are talking about, just the concept that no, we don't have to want to be at work all of the time. We don't have to give up all of our lives and all of our energy and our money and our sanity and everything to this profession. Like it's okay that we want to have other aspects of our lives that have nothing to do with veterinary medicine. And in fact, that's good. Because I don't feel like that was the message that I got when I was in school and when I, had just graduated. It was like, don't complain and just suck it up and just kind of do it. And if you don't like this, then you're in the wrong field, kind of thing. So I'm very happy and reassured to hear more people talking about that, to talk about quality of life, because that was something that never even occurred to me when I was first graduated and having my first baby. I thought, okay, well, I'm just the one who's supposed to suffer so that, I can just meet everybody else's expectations. But now I'm grateful for all the people who are out there talking about the fact that no, that's not a realistic expectation. And that's why so many people are burning out and leaving the field and unhappy, is because we're trying to just give everything and not really expect any, we were at least in the past being told that it wasn't reasonable to expect to want to have a good, quality of life. So I'm very encouraged by that. I still think there's room for that to improve more, though.
Agreed. Yeah, thanks, Emily. I mean, it is encouraging. I was smirking a little bit when we think of 2005, 2008, Jonathan's 2009. We're all coming up on 15, 20-year reunions. But it's nice to see a lot has changed in that time, and there'll be lots to come. But thank you so much. I mean, congratulations. I know what a lift it is to have this launched, and what a valuable resource. I guess it's that time. We have to move into our impact round here with you, Emily. A series of short questions for you. First of which is, are you a cat or a dog person?
Oh, I'm both. I guess if I had to pick one, I'm leaning more towards being a cat person these days.
Okay, nice. True or false? I knew I wanted to be a veterinarian since I was a kid.
True.
How would your friends describe what you do for a living?
Trying to do too many things all at once and raise toddlers and teenagers at the same time and trying not to go crazy.
Yes. What is your favorite hobby?
Horseback riding,
Nice.
which I haven't done in years, but I love it.
What in this world are you most grateful for?
My family.
Excellent, Emily. Okay, for those of our listeners that want to reach out, want to get a copy of the book, by the time this airs, it will be available. Where can they track the book down? Where can they track you down?
Yeah, so there are a lot of different ways. My website, I have links to purchase the book on several different platforms on my website. So that's emilysinglervmd.com. I have my Instagram, which is also Emily Singler VMD, and LinkedIn, Emily Singler VMD. And then for those in veterinary medicine who are parents, if you sign up through my website, you can get a link to join. I have a private Facebook group called the Veterinary Parents Community. So we're going to be doing some Q&As and just sharing other information there. It's different from the vet moms because it's not just for veterinarians, it's for all members of the team. It's for dads too, non-birthing parents, everybody. So we're working on growing that group. So again, you could just look for the link on my website, and I share a lot of that stuff on Instagram as well.
Excellent. Well, thanks again, Emily. Thank you. You passed along a copy to me, so thanks for letting me dive into your book. Very informative. As always on the podcast, we leave the last word to you. What message do you want to leave for the veterinary community?
I would just say that there are so many parents out there who are doing and want to keep doing amazing things in our community, and that we should continue to find ways to support them as best we can. And to all the working parents out there, you're not alone, and I see you.
Thank you for listening to the Veterinary Project Podcast. As a recap, on behalf of our hosts, the Veterinary Project Podcast will be releasing new episodes weekly. So be sure to tune in as we bring you more conversations aimed at helping you enjoy a life well lived. If you enjoyed what you heard on the show and you want to stay in the know, please like, love, and/or subscribe to the podcast on the listening platform of your choosing, as we're available on all the usual suspects. If you know of others that may benefit from these conversations, we'd love it if you please share the show with them, as this will help us grow our community to reach more and more veterinary professionals. Speaking of which, if you are a veterinary professional and would like to get connected with more like-minded individuals who are joining us on this journey, please send an email to the veterinaryprojectpodcast@gmail.com, and we'll invite you to be a part of our private Facebook group. General feedback, requests for information, or perhaps requests to be a guest on the show can also be sent to the Veterinary Project Podcast @gmail.com. Dr. Michael Bugg and Dr. Jonathan Light, thank you for listening to the show, and we'll catch you again next week for another episode of the Veterinary Project Podcast. Bye for now.